I'm Chad Hoyle. I'm a neurologist here at Ohio State University. I specialize not only in general neurological disorders, but also specifically in neuromuscular disorders and in a study called an EMG that is a procedure that diagnoses neuromuscular disorders. Like a lot of neurologists, whether it was in med school or even before that, I found studying the nervous system to be very fascinating. I felt that it was clearly the most interesting area of the body and things that we studied in medical school. But I think more importantly in relation to patient care is seeing the impact of neurologic diseases in the impact that it has on patients. And I have a very close family member who has a neuromuscular condition, and I think seeing that and seeing the impact and wanting to help patients out with neurologic conditions is really the main driving force in my patient care philosophy. And so I think that if I could summarize the patient care philosophy, I'd say sort of like the golden rule of wanting to treat patients the way I would want to be treated, or the way I'd want a close family member of mine treated. And so those have been the main driving forces of going into neurology and what has driven my patient care philosophy. The most rewarding part of my job in being a neurologist, there's really a couple things. I mean, one is I think that when neurologic disease, as I mentioned, has a significant impact on patients. And so when you see a patient who is having trouble walking or having the major function of their life being affected, and it is a disorder that you do have a good treatment for and you can get them back to relatively normal functioning, that's very, very rewarding. And I think all neurologists are looking for opportunities like that to help a patient out that way. But also, even in conditions that we don't have the best treatments for, we do develop long-term chronic relationships with our patients, and just interacting with our patients is very rewarding. Patients with neurologic disease might be going through a lot of trials, but we try to look at the patient as a whole and develop relationships with them long-term that are very meaningful, and that's a very rewarding aspect of our job as well.